I'm thrilled to be interviewing Stephanie Lahr, who is a fantastic thought leader from Artisight. So, Stephanie, tell me, with health coming up, what is one critical and pressing issue facing healthcare right now?
Well, I think, healthcare is really looking at artificial intelligence closely and trying to figure out all the ways that it can bring innovation, whether that's through clinical decision support, whether that's through automation of processes. But I think there's also, now that we're a year and a half or so past this ChatGPT onrush into the health system and ecosystem at large, now some deeper thinking really going on around, well, wait, what is the best use of these tools? How can we use them safely? So I think we're going to hear some talk about AI governance. And I know it's not the most exciting topic, but the reality is that if we're going to use these tools in effective and safe ways for our communities and patients, that's going to be, I think, a really key element is figuring that out. And then I think one of the other things that organizations are really starting to grapple with, and I've heard at a number of other conferences recently, is great, we have these cool AI tools, but the data that we need in order to leverage those tools effectively might not be the most amazing data. We as health systems have a lot of data, but some of the quality of that data is not to the standard that it's going to need to be for publishing and being able to do predictions and things. So I'm hopeful that what we're going to start to hear maybe is something around how do we use artificial intelligence to gather data, perhaps rather than thinking about artificial intelligence to crunch the data. We'll need to do that. But I think there's a real opportunity to think about artificial intelligence in the collection of data.
So interesting. And I could not agree with you more. I'm hearing this constantly in the industry. What innovations do you feel will really help solve these, pressing issues that are at hand here?
Yeah, I think when we think about collecting data, the reality is first we have to think about how is most of our data collected today. Most of our data today is collected by our clinicians, walking up to a keyboard and typing and or clicking in boxes to capture the appropriate information. I think we are going to start to hear, and we are already hearing about, and obviously near and dear to my heart because of some of the work that we're doing, but I think, artificial intelligence through natural language processing and ambient listening, as well as computer vision, and then potentially juxtaposed with, thinking about RTLS systems in new and novel ways where we capture information about where things are at, but less so thinking about, the MRI, the C-arm for the CT is right here, but more this person is here or this asset, how does that relate in? So if we can capture information from ambient technologies like cameras and speakers and RTLS kinds of systems, I think we can improve the quality of the data and then use those ambient sensors to really collect the data.